And that leads to sensations of grittiness, itching, tiredness, heaviness by the end of the day, wanting to squeeze the eyes, chronic redness, just general discomfort in the eye. I think close to 50 to 60%, it's 56% if I'm not mistaken, of patients who attend eye clinics are patients with dry eye.
Did you notice a surge in your patients complaining with dry eyes after the pandemic lockdown?
The primary problem is the screen.
Uses computers and digital devices. Are there other reasons or factors which cause dry eyes?
When the upper lid touches the lower lid, like that, with each blink, a little micron of oil is pushed out of the glands. So one simple rule is called the 20-20-20 rule.
Yes.
The 20-20-20 rule means that every 20 minutes, look at something 20 feet away for 20 seconds. Machine that's going to give you fixed temperature of 96 degrees, 96.4 degrees centigrade temperature. You need a very good grinder. Then you tamp the coffee at a fixed tamping pressure. It's got, I'm not sure how many pounds, but there's a fixed thing. It comes fixed as a particular temp. Then you put it back in the machine.
Long-term dry eyes could impair our vision. So today we're going to talk about a condition called digital eye strain, or known as computer vision syndrome, or commonly known as dry eyes. And I thought, who better placed than the eye doctor in town, Dr. Navin Sakhuja, to talk about this. So Dr. Navin Sakhuja is the most sought after doctor in all of Delhi, especially South Delhi. He's Mr. Popular across all ages, from school-going kids to super senior citizens. We will see him flex from English to impeccable Punjabi when he's talking to the seniors. And I would say equally popular with both men and women alike, which is unusual. But Navin is Navin. And in addition to being a very, very able eye doctor, he's also an avid photographer. So he's done, I think, several photography exhibits in Delhi, showcasing his work when he shot in Arizona, South Africa, Iceland, Ranthambore, Cambodia, Leh Ladakh, and the list is endless. So I would like to think of Navin as the Shah Rukh Khan of the eye field. He's witty, intelligent, and full of beans. At this point, I should draw him in before he gives me the eye. Hello, Navin.
Hi.
Thank you for making time.
My pleasure.
Finally, we've managed to grab you. Right, so dry eyes. What sort of symptoms do your patients present when they come to you with dry eyes? Is it pain in eyes? Is it dryness? Is it itchy? What is it?
See, in terms of statistics, I think close to 50 to 60%, it's 56% if I'm not mistaken, of patients who attend eye clinics are patients with dry eye.
Oh, right.
It's a lifestyle-induced condition.
Right.
Now, dry eye is of two types.
Okay.
There's a secretory dry eye,
Right.
in which you fail to produce tears,
Right.
which is the much rarer form. I mean, you see very few patients of secretory dry eye, and that's fortunate because secretory dry eye is an extremely painful condition.
Oh, right. Okay.
The common condition, which everybody, possibly even you and I, have to some extent, is a condition called evaporative dry eye.
Right.
Evaporative dry eye means we have the ability, the patient has the ability to produce the tears,
Right.
but cannot retain them.
Right.
So, to understand this, you need to understand that the tear film has three layers.
Right.
A base layer of mucus, which allows the fluid to spread on the eye. So the eye is very shiny, like a shiny new car. Nothing will stick on it.
Okay.
Then there's a layer of water, which is what you know as tears. Contains water, sodium chloride, vitamins, oxygen, all sorts of nutrients that the eye needs.
Right.
And above that is a layer of oil. That is the most important layer. It's called the lipid layer. Now, what happens in evaporative dry eye is the primary problem is the screen.
Right.
Because of constantly looking at the screen, continued looking at the screen, the brain is sort of hypnotized by the data that the screen is processing for you.
Right.
And it teaches the eye to stop blinking. So when the eye blinks, when the upper lid touches the lower lid, like that, with each blink, a little micron of oil is pushed out of the glands, which are both located in the upper and the lower lids.
Right.
When you don't blink,
Right.
the glands can no longer secrete the oil. It's just a partial blink.
Right.
And so there's a layer of mucus, there's a layer of water, but there's no layer of oil. So the tears come in and they evaporate. They come in and they evaporate. And that leads to sensations of grittiness, itching, tiredness, heaviness by the end of the day, wanting to squeeze the eyes, chronic redness, just general discomfort in the eye. And so patients will come with varied symptoms. Most of them will talk about the fact that the eye gets very tired by the end of the day.
Right.
So that's the pathology of what happens in dry eye.
Right. Did you notice a surge in your patients complaining with dry eyes after the pandemic lockdown?
Yes.
Because of excessive Netflix and OTT, just being on the screen all the
Yeah,
time.
yeah, and a lot during COVID also,
Right.
because they were all doing either studying online or working online. So they were always on a screen.
Right.
So definitely there was a significant increase. And I think there's been an overall increase over the years,
Over the years.
because now everything has become online or has become digitized.
Wow. So, in addition to prolonged use of computers and digital devices, are there other reasons or factors which cause dry eyes?
Yeah. We are talking primarily of evaporative dry,
Yes.
because secretory is a congenital thing.
Correct. That.
So evaporative would be contact lenses are another.
Okay.
Prolonged air conditioning is another. Increases evaporation also.
Right.
And the previous LASIK surgery or previous cataract surgery, patients tend to have more dry eye because the surface is altered a little bit.
Okay.
The corneal surface is altered. Then post-menopausal women and men, as they age due to alteration in hormone production, that causes dryness. Excessive washing of the eyes causes dryness, because it's a common misconception that wash your eyes every time you feel dry, but actually you dry them out further every time you wash them.
Oh, okay.
So it's like washing your hands again and again and again, then your hands are going to just lose their natural oils and become dry. So that's exactly what's happening in the eye.
I was reading somewhere where they talked about insufficient hydration. So if you don't drink enough water,
to some extent. I mean, it's not a primary, it's not sort of a cause and effect. Like, oh, you can't say now your eyes are dry, drink lots of water.
Okay.
But
Right.
certainly that it certainly.
Also, I was told that women you tend to use these days eye creams which carries an ingredient called retinol. Does that also aid dry eyes?
See, retinol is actually we are talking vitamin A analogs.
Right.
A lot of times dermatologists use them for girls who got, or young people who got acne.
Yeah.
So that's a drug called isoretinoin, which is all basically similar groups, isoretinoin, retinol, so on. Now they cause drying. They do cause drying of the eye.
Right.
So vitamin A, while lack of vitamin A also causes drying, but vitamin A itself also causes. It's a double-edged thing.
Right. Would you say that long-term dry eyes could impair our vision? Would there be any correlation?
See, the secretory dry eye patients can go blind also. All right, it's serious. But evaporative dry eye, what it does is actually, because the corneal surface is like this, smooth and shiny like glass. And it's meant to look like this for the light to be able to pass through. But like all mucous membranes are the membranes like membranes in your mouth or your nose. All mucous membranes are always meant to be kept moist. So if the cornea is not kept moist enough, instead of being smooth where it is on the refractive surface, it becomes crenated slightly on a microscopic level.
Right. Okay.
So the vision, that the quality of the vision going in is not good, is not great. So even with the glasses, they find that their vision is not clear enough. Now, which is why occasionally when patients come back and say that their vision is not good, tell them we'll treat you a little bit for the dry eye first, then decide whether you really need to change your glasses at all or not.
Okay.
So yes, it can affect vision, not significantly, but it can alter the quality of vision.
Right. And what about dry eyes if not treated? Could they lead to, say, cataract or glaucoma?
No.
Affect your retina in any way?
No, dry eyes will not lead to cataract or glaucoma, but it's a good question you asked, because a lot of times when patients have itchy, uncomfortable eyes and they are seen by somebody who fails to recognize that this is coming in from dry eye, the panacea for sorting it out is steroids. So many of these patients are on chronic steroid use. Chronic steroid use will cause both cataract and glaucoma. So it's not a direct cause effect with the disease, it's more a cause and effect with the treatment, which is, I mean, injudicious treatment.
is there an off-counter drop or lubricant we could use? I know they're so high in sustained
There are many. I
Okay.
mean, there are thousands. You can actually, and they're all available over the counter everywhere in the world.
Right.
So even in
okay.
countries who are very strict about prescription-based prescribing, even there you can buy them straight over the counter. I mean, there's endless now. I don't want to name any brands,
Yeah.
but it's endless.
Those are the ones I know because I've been using Soha. So
Yeah.
happened to
So there are
mention it,
loads of
but
them.
yeah.
And there are loads of them. You can get preservative-free brands. You can get even single-use brands. Those are the best if you can get hold of those ones which don't contain a preservative, because you have to understand that you're going to be using it on chronic use.
Right.
So you don't want the preservative to damage your eye rather than the drop.
Right. Okay. At some stage, do you discontinue the usage of these eye drops, or we just have to live with it?
I think if the lifestyle stays the way it is, you have to live with it.
A couple of times a day, or
Yeah, 3, 4. It depends on it. This will vary according to the severity of the disease and discomfort,
and how much you use your
and how
digital
much you use the
screens.
device, and how uncomfortable you are with
Right.
with your life.
Right. Okay. Are there things we could do in our day-to-day life to avoid getting dry eyes? Because we can't avoid using screens. Is there?
See, some of the things you can do, because as I explained to you right at the beginning, it's a lack of blinking. You're not blinking. So one simple rule is called the 20-20-20 rule.
Yes.
The 20-20-20 rule means that every 20 minutes, look at something 20 feet away for 20 seconds. If you look at a bird on a tree, it does not grip your attention so much that you stop blinking. You look at it, you stare, your blinks drop back to the normal pattern, and it allows the oils to start flowing again. It doesn't allow the oils to become butter and then ghee and then become like a dirty toothpaste. So that's what ultimately happens to these patients. Yeah. So they ultimately stop secreting the tears. Then those glands become choked with they're like toothpaste. And that's why at the end of the day, when you want to watch TV, you feel like just squeezing your eye, because the eye is trying its best to get some oil out.
Right.
Which is, there comes the reason for saying that you need to do regular hot compresses. Regular hot compresses. If you do that, give your eyes regular heat, just once, twice a day, it would help a lot in sort of reducing the dry eye symptoms.
Once, twice a day.
Because it will allow the oils to flow.
Right. Are you doing any of this yourself?
I do it, but I should do a little more, I think.
Are you putting any eye drops and at least once a day?
Yeah, once or twice a day, because I get dry as well, because I have a lot of screen time.
Of course.
Yeah.
Yeah. I've read something which I thought was quite odd. When you were growing up, you were told have a lot of light in the room when you're reading, but for dry eyes, they say you should reduce the light on your computer screens, on your phones, draw the curtains, possibly not have a lot of light in the room. Is that true, or a bit of a misnomer?
Not really. Actually reducing the light on the screen is to reduce the strain that keeps coming from staring at an overly bright screen.
Right.
It's not for the dry eye so much as the fact that you're just unnecessarily exposing yourself to so much brightness the whole day.
Right.
Which is the reason why this in recent years you must have seen why people are wearing blue protective glasses, which are basically slight yellow tint on the glass. That's because it reduces the quantum of blue light coming in. Now, blue light has always been coming in. Blue is just a component of light. All light, sunlight, any light. But because the amount of exposure to the light has become so much now that from childhood till the age of 90, you're going to be exposed to that light, which is why they feel that it's felt that maybe you should be using, in fact, newer lenses that are used for cataract surgery are all blue light protective.
Okay. Wow. Do you advise using glasses for those if you don't have a power when you're working on the computer?
Not really. No.
Okay.
That doesn't really help definitely not for dry eye, and not even really so much for the glare, unless you're using blue light protective glasses. And then you're cutting out blue.
Okay. So to conclude, because I know you have to rush elsewhere, to conclude what we've talked about today, you're saying in terms of eye exercise, we should do the 20-20-20 rule, which is every 20 minutes, look at an object 20 feet away for 20 seconds, blink more, try and do at least hot compress once a day or a few times a week.
Yeah, and that is the cornerstone of your management.
That's your goal, okay. And try and use some lubrication, some sort of eye drops, any eye drops available off the counter. What about those exercises, the pencil exercise?
That's for convergence insufficiency.
Okay.
When because of the fact that you're on a screen for many hours, your eyes have to converge to see it. So they're constantly sitting in that converged position. So it's just to build up the muscles that the muscle that will help you to converge.
Yeah. And I don't think maybe it'll harm if people use less device time. I mean, it's
Easier said than done.
yeah.
You know?
I mean, even movies now, everything you're watching on your phone.
Not a very good idea.
Yeah. I mean, you've got
It's a
a
better idea to
TV.
watch it on a TV because you
TV.
at least you even though you will continue to sort of not blink as much, you will still blink less even on the TV, but at least you're not converged all the time. You're looking at something at 6 feet, 7 feet
Yeah.
away.
Is it also a distance that we should keep when we use our devices, like a computer or phone?
See, all these things are kept at different distances. Computers usually end up being at about 50 centimeters.
Right.
Most of the time, your phone or reading matter or magazine or something is kept at about 30 centimeters distance.
Okay.
And anything beyond 6 meters is considered as infinity. That means anything 20 feet and beyond, the eye is going to a position of rest. So when you have a TV at about say 8 or 10 feet away or 7, 8 feet away, then the eyes are slightly converged, but not as converged that they will have to be to look at something so close.
So you're not
So
straining.
not a good idea to see a whole serial or a movie or something on a phone. It's easier to see it on
a TV.
Yeah.
Yeah. Coffee. You talked about making coffee. Are you now a coffee expert as well?
I'm not an expert, but I love
Yeah.
making coffee. Yes.
Okay. Are you happy to share some recipes or
You have to tell me which coffee you want to know about. Do you
Oh,
want to know about? Yes.
oh,
you want to know about the
right.
espresso or the pour over or the you tell me
Oh,
what.
wow. So it's not just a plain cappuccino.
See, if you want to really make a good coffee, you have to know how to pull a good espresso.
Okay.
Okay, that's the heart of coffee making.
So you need a
So
good fancy machine.
more than you need stable machines. The machine that's going to give you fixed temperature of 96 degrees, 96.4 degrees centigrade temperature. You need a very good grinder that's going to grind to what you need to be ground. That's a little bit little finer than sand around, not like talcum.
Right.
Then you have to weigh the coffee prior to grinding and weigh the coffee after you ground it.
Oh.
So you can choose a 12-gram shot or a 14-gram shot or an 18-gram. Most really good strong shots are about almost 18 to 20-gram shots.
Right.
Then after you weigh the coffee, you put it into the portafilter, and then you have to remove the clumps from the portafilter because there's a positive negative association and the coffee tends to clump together. So you have something called the wise distribution tool with which you break it down. Then you tamp the coffee at a fixed tamping pressure. It's got, I'm not sure how many pounds, but there's a fixed thing. It comes fixed as a particular temp. Then you put it back in the machine. Now here comes the key. The machine has to pull the coffee at 9 bars of pressure at 96.5 degrees centigrade. When it pulls the coffee at 9 bars, the coffee, your grind and your coffee and your tamping and all must be so perfect that the amount of liquor that comes out has to be a 2:1 liquor from the weight that you made. So you had 14 grams, you have to pull out 28 grams, but in exactly 27 seconds. So if you pull it out in 40, that means you made a very fine grind. So you're going to get over-extracted bitter coffee.
Right.
Suppose it comes out all of a sudden in 10 seconds or 12 seconds, you'll get a sour, under-extracted coffee.
Right.
So that's why when you go to certain times, you go to a coffee bar or somewhere and you find that the coffee is not nice, it's because it's not been extracted properly. Everybody loves to talk about the bean. The bean is important, very important.
But the process
is way more important.
Yes.
Because till it comes out over here when we make our coffee here, it has to come out in 27 seconds. If it comes out a little longer, he's told to just chuck it.
Make another one.
Yeah.
So which is your favorite, espresso or?
I like espresso. Like a cortado sometimes. It's the 1:1 with milk, steamed milk.
Right.
Or 2:1 with steamed milk is like a cappuccino. And then the easier ways to make coffee. French press is the easiest method to make coffee.
So I think my viewers are going to love this because, it's like a buy one, get one free. So you're having a conversation about eyes, and now for all the coffee lovers out there, this is how you make coffee. And whatever he said is Greek and Latin to me because I'm a tea person. I have no idea about coffee. I've never had, I've probably had 1 or 2 cups of coffee.
Well, you should have a coffee here sometime and get to know what it's like.
I love the coffee in Italy, I have to say. I tried it last summer and it's something I've never had before.
Well, you'll get it here.
I have to come and have a coffee here. Because I have this, when I have coffee, my heart rate goes up.
Yes, everybody's does. See, coffee contains so much caffeine. So your heart rate goes up. It actually buzzes you. Which is why you have to be careful that you don't overdo it. Like because as a surgeon, I can't keep having coffee. I don't want any change in heart rate. So I have 1 cup after surgery in the morning, 1 cup. And I don't have like people drink 10 cups of coffee a day and 6 cups of coffee a day. I mean, I'm not sure that's the best thing to do.
Correct.
So I just stick to 1 in the morning, and I'm very happy with that 1 cup. A lot of ceremony goes into making that 1 cup, but
Yeah.
you know,
Is it addictive?
I think so to some extent. Yes,
Yeah,
certainly.
it's caffeine.
Yeah,
isn't
yeah,
it?
it is.
But I have to say, you know, the coffee I have here, I've only had once or twice. It's not A, not that tasty, and B, I do lose sleep. But when I had it in Italy, there was no problem with sleep.
You may have had a decaf then.
No, it was regular
No, if you get
cappuccino.
nice regular
It was
coffee,
beautiful.
no, when we make you a nice regular coffee, we will make sure you lose sleep.
It's going to be that potent.
Yes,
That's strong.
you will sleep.
Wow.
There's no way you won't lose sleep.
Now you've had it at this hour in the afternoon.
No,
late
I'm used to it. I just
afternoon.
had now because I had this interview and then I've got to get somewhere. So I just
You want
thought
to
I'll have
hear
1
it.
more cup today, and I don't have surgery
Yeah.
tomorrow.
Right. Fantastic. Brilliant. Thank you.
My pleasure.
Thanks a lot.
My
It's
pleasure.
been great. I found this immensely helpful. I'm very confident that my viewers will feel the same. And hopefully will, take better care of their eyes. Thanks.